begin, I want to make absolutely sure that this test is specific.
Yeah, it is.
Do you have any information?
About the test?
Yeah.
Yeah, it is. Are you scared? Do you think that I will not maybe detect the virus?
Well, that's the question. If
No,
the test
this test is for HIV virus.
is it?
Mm.
But I need to know that for sure because I've heard that that they're non-specific tests.
These ones are specific. It is just for so to do them research. Or you go and say that doctor, you talk to him, then you will get me.
Yeah. Okay.
Good afternoon. How are you? Dr. Hannington is my name. I'm Hannington, Dr. Hannington.
Yeah, I'm called Ricci Davis.
Oh, okay.
And yeah, I've been referred here because someone told me that you do HIV testing here.
Yes, we do.
In fact, I even saw it on the sign outside.
Yes.
So my question is there actually a test that can detect the virus?
Yes, we have two tests. There is one which detects the antibodies. You know antibodies?
Yeah.
The antibodies are the chemicals which the body secretes in response to the virus. Then we have another advanced test which can test the virus itself. Okay? Those are the two we can do here.
And which tests detect the actual virus?
Yes, what we call the viral load. They will tell you the actual virus. Yeah.
Okay, and this is performed by what's the type of test?
It's a PCR. The polymerase chain reaction.
Okay, yeah, I've heard of it, yeah.
Yeah, but it takes a bit of time. It won't be ready now. It will be ready next week.
And what's the other type of?
The antibodies within 15 minutes.
Yeah.
15 minutes you can get it.
So would you agree that it's very important that people are given a correct diagnosis?
Yeah.
A correct result?
Yeah, definitely.
Because there are many researchers who are now saying that the tests are, because they're not detecting the actual virus, they're being used as a basis to give people wrong diagnoses and followed by maltreatment.
I don't think so. Because what happens, the test for the antibodies is a series of 3 tests, okay? And they are very sensitive. Okay? Very sensitive. So what we normally do, we do one test that we call we do one test we call determine.
Yeah.
Okay. If this turns out to be positive, we don't give the positive results yet. We go to another test we call start back.
Yeah.
Okay?
Yeah.
If start back is still positive, then we go for the last test we call unigold.
Yeah.
If all the 3 are ready, then we give you positive results. 100% sure that you're positive.
Yeah.
But this will have detected the antibodies. We will not tell you the virus, the viral load. You want to know how much virus is in the body to detect the virus itself?
Yeah.
Then we do the viral load.
Okay.
Which we use the PCR, the polymerase chain reaction.
Yeah.
So you can see we go through a series of steps before we confirm.
How does the specificity of these tests compare with the specificity of, for example, ELISA and Western blot?
Of course, the ELISA is really good. It also does the antibodies, but it's also good. Of course, here you add ELISA as number 4. So when all these cannot determine, then we go for the ELISA.
Right. So the ELISA is considered more superior to the other tests.
Definitely, yes.
But then I don't understand. Then I don't understand why this statement is printed by the manufacturer of ELISA.
This is ELISA.
It's a photocopy.
At present, there is no recognized standard for establishing the presence or absence of antibodies to HIV-1 and 2 in human blood. Specificity is based on testing of random blood donors and hospitalized patients and sensitivity for HIV-1 and 2 antibodies expressed in terms of detection rate using confirmatory assays, Western blot, and ELISAs. Specificity is based on zero prevalence of antibodies to HIV-1 and 2. No, this is okay. This is for the ELISA, or this is for the this literature talks about ELISA or Western blot. PCR. Of course, the PCR is the most what I'm talking about.
Yeah.
That is the 100%.
So when I ask the question, is there a test that can detect the actual virus, I'm being given conflicting answers. I'm being told initially that yes, there's a specific test, the test detects the actual virus, but then after some conversation, it's then told that the test is looking for antibodies.
No, I said that there are two tests you can test for the antibodies, which you can use any of these test kits, determine, start pack, including ELISA and Western blot test for the antibodies. Then you want to be more specific and you want to know the type of virus, the amount of virus in the body, then you go for the viral, which is the PCR.
Right.
But of course you realize that in developing countries like Uganda, this one cannot be accessible to all of them. So we use this, which I told you is equally fine.
So for the time being, can we assume that the results produced from these tests are inconclusive?
Yes. No, they are conclusive.
How?
Conclusive.
How is it?
How?
If they're only looking for antibodies, then they would have to be looking for specific antibodies.
Yes, specific
that
for
are
HIV.
considered to be associated with HIV, but which ones are they?
The antibodies are specific for HIV, they are not for anything else.
How do antibodies differ from each other?
Yes, they differ. Because
how do they differ?
How they differ, it depends on the kind of infection. The antibodies for HIV are different for malaria, are different for typhoid, are different for any other infection. That's why we detect for the antibodies.
Right.
Each infection has got specific antibodies.
Yeah.
Yes.
Yeah, that's what I've learned.
So when we detect the antibodies for HIV, it means that there is a presence of the HIV in the blood.
Yeah.
That's why the antibodies for HIV are there.
So who decides which antibodies are for which disease?
It's not the body decides.
But the tests have not been calibrated by...
They are calibrated.
They've been calibrated in the laboratory,
yes.
presumably.
Depending, when you have an infection, let's say you have a HIV infection, the body produces antibodies, which are the chemicals specific to the virus. That one is there. So what these manufacturers of the laboratory tests have done, they have isolated the antibodies from the blood and incorporated them into a test kit. So when the test kit detects those antibodies, then it means that you have the antibodies in your blood.
You mean that they've calibrated these tests from the direct finding of HIV?
Yes, it's from the direct finding of HIV. That's why there's HIV research every day. That's why we do research, yes. We get someone who has HIV and isolated the antibodies in the body.
Well, that's strange. I was under the impression that the reason research continues to be conducted today is because research has failed to produce a single benefit that can be translated into clinical health improvements for patients.
I think that is very unfair to the people who spend sleepless nights doing the research. That's why we came up with the antiretroviral drugs. How did the ARVs come about? Well,
they came about as a result of conducting experiments or using AZT.
Yes, and that someone must have spent sleepless nights doing that. So when you say the research has failed to produce, then it means you are being unfair to the scientists who are doing that.
Well, the man who developed AZT, called Richard Davis, actually developed AZT as an alternative chemotherapy treatment for cancer patients. And as far as I understand, the hallmark of cancer is rapidly dividing cells. So to then come along 10 years later in about 1985 and proposed that a T-cell killing drug should be administered to people who are deemed already to be losing T-cells. Seems to be a bit of a contradiction. Because the hallmark of AIDS is supposed to be T-cell depletion.
Yes, because the virus attacks the T-cell, the CD4.
Yeah, so why give a cancer drug to AIDS patients?
First of all, understand what's the cancer drug, what's the cancer trying to achieve.
Yeah,
Two things.
To kill rapidly dividing cells.
No, not to kill the dividing cells. You see, cancer and HIV almost are the same. Why? Because those are they cause immunodeficiency. Okay? The cancer attacks the cells, the HIV attacks the cells. So it means the treatment would overlap. You know? You realize, I'm sorry, I have so many patients waiting for me, so I do not want to spend a lot of time. If you could have some time to talk more on the academic part of the HIV.
Look, this is what happened to the AIDS patients who were given AZT in 1987.
Yeah, of course, all these are the same side effects you get with the cancer drugs. Hair loss, it goes down. So you still get it.
Right, but the problem for the doctor and the patient in this instance is that nobody really understands if it's the drugs that are causing the immune deficiency or the virus, because 5 of these side effects are AIDS-defining illnesses.
Yes, the virus,
including T-cell depletion.
Yes, including that. Yes, the HIV causes immunodeficiency because it attacks the immune system.
What does?
The CD4.
I'm talking about AZT causing T-cell depletion.
Yes, T-cell AZT causes T-cell depletion. Yes, it could be.
There's nothing in the literature to support the idea that the AZT causes T-cell increases.
But the AZT would not directly cause the cell increase. There is no any ARV that can cause the direct cell increase. There is no. What happens? It's an indirect effect. The ARV stop the multiplication of the virus, then the virus is reduced in the body, then less of the virus attacks the T-cell, then the T-cell goes up. You get it?
Yeah.
There is no ARV which are directly increasing the T-cell. There is no that mechanism. It's a feedback.
Yeah.
You get it?
Yeah.
Yeah.
So, but on page 11 there is a list of 70 factors that cause positive results, including TB, malaria and pregnancy, on all tests.
I don't know. How do you want me to help you? Let's be very specific.
Well, yeah, I've been tested many times, and I've always been told that I've been tested for HIV, and now I've come to understand that probably.
So when they test for HIV, they find you have HIV?
No, they find me negative.
You find it's negative.
And I can't understand why I continue to test negative when I've always been sexually promiscuous and never used condoms.
And
just like all the other Europeans and Americans.
Have you ever done a PCR?
Well, that's what I wanted to come to. You said that viral load testing is specific and reliable, but the manufacturer of PCR says that the contrary.
This is just one part. There are different types of the PCR.
There's one package insert, and this is the same one I get given every time. This came from Walter Reed Project.
Yes.
They all
tell you that.
Pardon?
They all tell you that. What did they all say?
They all disclaim themselves from the test having anything to do with the virus, and yet viral load is not viral.
So, what do you want me to help you?
I want you to show me a test that can do what it's purported to do.
You see the problem, what is happening here, Mr. Smith? What is happening? You think you have the virus in your body, and you want a test which can satisfy what you're thinking. But then the reverse could be true. You find that you do not have the virus in your body. And you do all these tests and it will be negative, but you're still not convinced. Equally, you find someone is positive and still denying he's positive. You do all kinds of tests and it will still be positive. And you still read everything about the internet and tell you.
Yeah, I'm sure he would have the same
He
problem.
will have the same problem.
He will come to question whether he has actually the virus in his body because there is no test for it.
The test
He's
is there,
tested
Mr. Smith, the test is there. Can we do I first do the rapid test, so I do the ELISA and the PCR, then we see what comes out. Do it here. Or you still not be comfortable?
I'm not convinced because they don't even use rapid tests in the Western countries.
They don't use the rapid test.
No, and there have been reports that they're useless in Africa. So
That's
how
they
can they
only
be
used in
considered
Africa.
useful where we are?
That they only used in Africa, the rapid test.
That they're useless because the lab technicians, they say that they're not reliable.
No. That is not right. Mr. Smith, that is not right. So, tell me what you want me to do for you.
I just came to, like I said, I came to the
ask.
reception and I asked for a specific test and the woman said yes, they detect the actual virus.
This,
But again, as further conversation continues, discovered that we're looking for antibodies.
No, PCR will not detect for the antibodies.
This is PCR.
Yes, but there are different types of PCR. I'm telling you because
And they all carry this message.
Yes, I'm saying this could be one type of the PCR that is done. There are many types of PCR which is done. Okay? PCR means polymerase chain reaction.
Yeah.
There are different tests and machines which can do polymerase chain reaction.
Right, but this is the one that's generally used.
Yeah, but we are not using the same. That's what I'm telling you. Which is this type of the polymerase chain reaction? This is one of them.
There's every viral load test carries a similar disclaimer.
Every viral load test.
And it says that they're not detecting the virus.
Well, I don't know, Mr. Smith, who will help you with that if you're still insisting that there is no test which can detect the virus.
Well,
do you think I will?
But how much more information do we need?
No, this is just part of it. There is all the information.
Even the Western Bloc test manufacturers insist that the results of confirmatory tests require additional testing.
Yes, which is you do in the series, which is what I told you. You cannot only do one test and confirm. You understand what I'm saying? You cannot say you're doing a determine and you're going to confirm. You are going to do a series of tests.
Well, this sounds tantamount to circular logic.
It is not
circular logic. If there's not one test that can detect the actual virus, then having 3 tests is an admission that they're not doing what they're purported to do. And yet having 3 tests is being used as a promotion for the test.
No, it's not a promotion for the test. Why would someone promote the test on someone's life?
Because they don't, half the time they don't even know the brand names of the tests that they're promoting.
The brand names of the test, but the vitamins are brand names. That part is a brand name. It's a brand name.
Yeah.
These are manufactured by Abbott Laboratories in the United States.
Like this one. Sorry, ELISA.
That one is manufactured by ELISA.
Yeah.
Who manufactures that one, ELISA? The one you're talking about.
This ELISA.
It's which
Abbott Laboratories.
It's Abbott?
Yeah.
Is it Abbott?
Yeah.
Where is it? So, where is the manufacturer for that?
Well, I don't know, but I can.
So we can see.
But when I had the original, I saw the logo on the bottom left-hand
You should have
side.
seen. You will get me the authors of this. You see me. You show me the laboratories, and then I will see.
Yeah.
Okay.
I'll give you a DVD.
I will give you my number, so you can talk about it. Hannington is my name. It's my email there. It's my contact.
Thanks very much.
Okay. Then you can talk about it.
many Westerners are concerned about what's happening in Africa because there's no AIDS in the Western countries.
It's a big debate which we can talk more about. We can even have a cup of coffee. I can have this.
You can make a copy and then I can take it back and while I wait in the waiting room if you like.